Hi, this is a summary of an article that appeared in the January 2017 edition of Scientific American called New Pathways for a Struggling Heart. It describes a gene therapy devised by a company called Angiogenesis, which is attempting to increase what's known as the collateral vessel circulation of the heart in order to increase survival rates from cardiovascular disease. Cardiovascular disease killed over 45,000 people in Australia in 2016. So any research into increasing survival rates from cardiovascular disease and thus increasing what's known as the collateral vessel formation of the heart is very important. Survival from cardiovascular disease depends upon a number of factors: how quickly treatment is administered, the severity of the event, and the general condition of the patient prior to the event. All this depends on what's known as the heart's collateral vessel network. Research has shown previously that exercise increases collateral vessel formation of the heart. After a cardiovascular event, doctors usually insert what's known as a stent or do bypass surgery. However, it's not always successful. What happens in a cardiovascular event? Heart is deprived of oxygen, pain results, and eventually death of the tissue occurs, and what's known as myocardial infarction occurs. As previously said, bypass surgery or stents are not always successful. As it happens, the heart has its own way of dealing with blockages. It actually increases, it has its own collateral vessel formation, although this is not always enough for people to increase survival from cardiovascular disease. Increased collateral vessel formation occurs through the sheer force of blood through the vessels, release of growth factors, and oxygen stress in the heart tissue. So it can be seen how exercise will increase collateral vessel formation of the heart. The point of this research is about people who can't exercise, however, and those people with mild to severe cardiovascular disease. Research by Angiogenesis has developed protein genes that push the heart to grow new collateral vessels. However, previously large volumes of protein has been required to increase collateral vessels. Previously, protein genes such as VEGF and FGF have been used, as I said, but large volumes are needed. So angiogenesis has turned to gene therapy by using the gene for FGF. What is FGF? FGF is fibroblast growth factor and has a key role to play in wound healing and various endocrine pathways. It is a key player in processes of proliferation and differentiation of a wide variety of cells and tissues. In this research by Angiogenesis, the gene for FGF is inserted into a benign virus that infects cardiac cells. It then churns out growth factors. The research actually looks promising, as the FGF has increased collateral vessel formation in healthy individuals and people with mild cardiovascular disease, but so far not for those with advanced cardiovascular disease. The research does look promising, and more research is needed. Their key researcher is a fellow called Gabor Rubiani, who is working on the next project, and he is working to increase survival rates in people with severe cardiovascular disease. Thank you.